Hello everyone. Today I am going to discuss with you a very important topic in law and medicine, and that is health as a fundamental right and human right. We all understand the term health, fundamental right and human right and their meaning. See, since 17th century we can say that human thinking is veering round man. Okay, man or human beings, we as a human being we have certain rights like basic rights, natural rights and inalienable rights. Whenever a person is born, that person is already acknowledged with certain rights, and these rights cannot be snatched away or taken away from that human being. That means once a person takes birth, he is already, you know, getting some rights. Now, see, human rights. Let's talk about human rights. See, human rights, we all know that, they are the standards. They try to recognize and give protection to the dignity of all human beings, isn't it? We can say that, how a human being will live in a society, what rights that human being will have in that society, what relationship that human being will share with one another, what relationship will that human being will share with the state. So state also has an obligation towards human beings, and vice versa, it is vice versa, right? So state has, given human rights to us, and those human rights cannot be taken away. For example, we cannot be tortured, right? We cannot be met with cruelty, right? All these are, you know we can say derogatory to human beings. Okay, now see, when we talk about function of state recognizes these rights, human rights, fundamental rights, the very basic rights, right? It recognizes them and it tries to promote effective social and democratic way of life, right? The objective of a state, right? If the objective is a welfare state, then obviously the state will have an obligation to take care of all basic and fundamental rights. It cannot take away them, right? Now, see, let's see some glimpses of health as a fundamental right. See, let's start with Universal Declaration on Human Rights 1948. See, this declaration or this document, it actually developed, moral, political, and, it indirectly created a legal importance. Now, this document, this Universal Declaration on Human Rights, it contains certain, general legal principles and human rights norms that are recognized by customary international law. Okay, and this declaration, that is Universal Declaration on Human Rights, it mentions health under Article 25, as a part of the right to an adequate standard of living. Why? Because all human beings, they are born free and they all have some kind of dignity. Okay, and that cannot be taken away. We all are entitled to rights and freedoms. According to UDHR, there are certain rights that have been set forth in this declaration. And the rights which have been granted by UDHR, it says that, the UDHR says that without any discrimination, without any distinction, on the basis of race, color, sex, language, religion, birth or other status, we cannot discriminate, and we cannot discriminate among human beings, right? Similarly, we have declaration on the rights to development. Right. Now, see, this declaration also, the Declaration on the Right to Development, it also states unequivocally that right to development is a human right. Okay. And this has been adopted by the United Nations also. And this Declaration on the Right to Development, it actually came into being, after many years of UDHR. And, according to this declaration also, human rights, they have civil as well as political rights. They have economic rights. They have social rights. Okay, we also have International Covenant on Economic, Social and Cultural Rights. We have International Covenant on Civil and Political Rights. All these international covenants, they talk about, economic rights that are bestowed in human beings, social rights, cultural rights, political and civil rights, right? We have International Bill of Rights. All these rights, please remember, they are interrelated, right? They are interdependent components of human rights, right? See, we also have United Nations Convention on the Elimination of all forms of discrimination against women, right? Although this convention is focusing on women, and any kind of discrimination against women should be eliminated, right? Basically we call it CEDAW. Now, this convention also, it realizes the right to health without any discrimination, right? Right to healthcare, right? Right to, family planning. Okay. So all these rights are also recognized by the United Nations Convention on the Elimination of all forms of discrimination against women. We also have United Nations Convention on the Rights of Child, 1989. It also recognizes, the rights of a child, right? And how this convention tries to attain standard of health, right? It tries to provide facilities for any kind of treatment of, illness. It also talks about rehabilitation of health, right? Article 24 of this convention. Okay, so did you understand? Like, these are some of the important conventions that are focusing on human rights, and health being one aspect of human health, human rights, right? A fundamental right. We have more important points on health as a fundamental right. See, we have European Social Charter, right? This European Social Charter has been revised many a times, and it also provides right to the protection of health, Article 11, right? We have American Human Rights Convention. Okay, now it also talks about right to health in terms of World Health Organization. We are going to discuss WHO. All right. And, right to health being the highest level of physical, mental, and social well being. We have African Charter on Human and People's Right. It is also called Banjul Charter, right? It came into existence in 1981. It guarantees everyone, you know, the best attainable state of physical and mental health. All right, so all these conventions, all these charters, they are trying to re-emphasize and focus on health being a fundamental right. All right, being a human right. We also have Declaration of Geneva 1948. All right, we have World Medical Association. It contains, in fact, Declaration of Geneva 1948 and World Medical Association, they are one and the same thing, right? So, World Medical Association has certain code of ethics. Basically, the members, like medical professionals, the members of these medical professions, they take oath, right? When they are admitted into medical profession, that they will treat, everyone equally. They will not discriminate their patients. They will provide equal treatment to everyone, right? They will not discriminate whether this person is rich or that person is poor, right? Now let's discuss very important organization, that is World Health Organization. See, World Health Organization, all right, if we talk about the preamble of World Health Organization, then it already clearly says that every individual person, they have a fundamental right to enjoy the highest attainable standard of health, right? A state should take care of the physical, mental and social well-being, right? We have World Health Organization standards, right? Everybody must have access to medical facilities, medical treatment, and that too without discrimination, right? It should be, the medical facilities should be, easily accessible to people, especially if we talk about women, children, older people. right? People who have some chronic diseases or people who are disabled, right? Medical facilities, treatments, they should be affordable by everybody, including poor, including socially disadvantaged people, right? They all have right to seek good health services, right? In fact, if we talk about World Health Organization constitution, right, it clearly envisages that the highest attainable standard of health as a fundamental right of every human being. Okay, so health as a human right, it also creates legal obligations on states, as I've mentioned in my very first slide. Right? It also means that we as a human being, we should have access to affordable healthcare services, right? Quality services. We should have proper sanitation services, proper food services. We should have proper health related information. All right, so all these things are interconnected, right? There is an obligation on the state to support right to health, right? And also the state allocates the available resources, right? Then only it will be able to realize the goal, right? Through various international human rights mechanisms, right? As we have discussed above, we try to achieve right to health in our domestic and municipal laws. So basically, a right based approach is required to attain health policies, right? Health policies, health programs should be there, right? So this should be the priority of the state. We should try to work towards providing health services to everyone. See, apart from World Health Organization, we also have 2030 agenda for sustainable development and universal health coverage, right? So this also talks about right to health. It must be enjoyed by everybody without any discrimination, right? There should be equality. There should be equal participation of all like stakeholders, states, NGOs, non-governmental organizations, basically, right? And they should all involve in all the phases of human right related aspects, such as planning, right? Analysis, implementation, proper monitoring of health related schemes and services. Proper evaluation should be there, right? In fact, when we talk about right to health, it includes freedoms and entitlements also, right? Freedom as in the right to control one's health and body, right? Right to be free from interference, for example, free from torture, right? Right to control one's health, for example, you know right to have reproductive rights. One is free, right? One is free, one should have freedom from being tortured. Entitlements also includes the right to a system of health protection, and it gives everyone an equal opportunity to enjoy the highest attainable level of health, right? Because violations or lack of attention to human rights and health being one of the most important aspect, it can have serious health consequences, right? Mental ill health, right? This also has a serious consequence. And violation of human rights, it contribute to poor health, right? Disabilities. All right, moving ahead, now let's discuss the core components of the right to health. See, right to health, all right, it has you know few important, or we can say, core components, right? So the components are, as you can see here: availability, accessibility, acceptability, and quality, right? Now see, what do you mean by the term availability? See, availability means something which is in abundance and it is available to everyone, right? So sufficient quantity should be there. Like if we are talking about health, then healthcare facilities, goods and services, health related programs, right? They should be available at all different stages, right? And they should be available to everyone. Okay, we have accessibility as a core component. Now, see, it requires that, health facilities, goods and services, again, they all should be available to everyone, right? Without any non discrimination, right? Physical accessibility should be made available. There should be, economic accessibility also. That means affordability. Everyone should be able to afford it, right? There should be information accessibility. All right. So when we are talking about accessibility, it also requires that, there should be analysis of some kinds of barriers, like physical or financial, right? They exist. And how these will affect, health services and right to health should be analyzed, right? Policies should address these barriers, right? We should have robust monitoring system related to health information, right? The third core component is acceptability, right? It Acceptability, it means that, medical care, medical facilities, they should be provided, you know in accordance with the principles of medical ethics, right? They should try to improve the health of people, those are concerned with it, right? Minorities, communities, they all should be taken into account. All right. So it means that, medical facilities and medical care are appropriate, and an adequate quality from scientific and medical point of view should also be taken into consideration, right? So acceptability requires health facilities, programs, services that are people centered and they cater to their specific needs, right? In consonance with international standards of medical ethics, right? The last component is quality. Now, see, goods and services, right? Facilities, they should be, firstly, medically and scientifically approved, right? Quality is a key component of universal health coverage, right? Quality, it includes, you know, safety, right? Effectiveness. It should be people centered. It should be timely. It should be equitable, right? That means safety of people should be concerned, should be taken into consideration, right? Injuries should be avoided. There should be effectiveness of, healthcare services that are provided to the needy one, to the people who need them, right? There should be timely, right? uh, Without wasting time, they should be provided to the needy at a proper time, right? There should be equitability, right? Care should be provided, right? There should not be any gender discrimination or geographical discrimination, right? There should be, maximum availability of resources, and they should be available to the benefit of everyone, right? Efficiency should be there. See, we also have, international code of medical ethics, right? And the it is a duties of the doctor to, take care of the sick, to preserve human life, right? They should provide, emergency care services, right? So all these are the duties of of doctors also. All right. Now see, uh, I have discussed the Indian position, related to right to health in the continuing slides. I'll make another video, and then in that video we are going to discuss the Indian position as to right to health. We are just going to discuss, some important cases on right to health, and, important provisions in the Constitution of India that talks about right to health. So in my next video, we'll cover all these topics that are related to Indian scenario and Indian position. So thank you everyone. Keep watching.